So first of all, let's go over the components of your Ozempic pen. Now, this is a demonstration pen, so yours may look a little bit different, but the components are the same. Most importantly, this is a multi-use pen. It will last you several weeks, but the needles we'll talk about are single use to reduce the risk of infection. So we call it a pen because it kind of looks like a highlighter. First of all, on this end, we dial in our dose each week. This is your dose counter window. It should always return to 0 once you've done an injection. You take the cap off the end to see where the medication is stored, which is in this plunger system here. Each week as you inject, the plunger will advance. When it gets to the end and there's not enough medication to be delivered, you actually won't be able to turn the dial on the end. So like I said, to start, we'll start at usually at a low dose, 0.25 milligrams. And you'll see that pop into view on the dose counter window. Don't worry, if you go too far past it, and you need to dial back, you can. So next what we'll do is we'll open our box of needles, which comes with your pen. Again, these needles are single use. As you can see, I've already used one from this box. So take one out, take the protective seal off the end, and we're going to take the cap off your pen and screw on your needle until it catches. This can take a few turns. Is very important. There's 2 plastic caps on the end of your pen. 1, 2. You should be able to visually see the needle. If you can't, you've left one of your caps on. The needle is very, very, very small. Be careful not to bump it or bend it because it can bend. So when we do our injection, we're going to keep our fingers on either side of this dose counter so we're not covering it, and we're going to put an index finger on the end here. You're going to inject into the skin of your abdomen. We'll pretend this is your abdomen. So what you're going to do is you're going to insert the pen needle into your skin and push it in as far as it goes till it's not going any further. You're going to press the button on the end of your pen and hold it. And I want you to watch what happens to the dose counter window and inside your skin. So I'm going to press and hold. You could hear it made a ticking sound, and now the dose counter has returned to 0. Now I'm going to say 1, 2, 3, 4, 5, 6, and then let go of the button and take it out. Because the medication was actually being injected for some time, and if you take your hand off the button too soon, some of the medication is still coming out the end of the needle, and you don't know how much was actually injected. So to make it easy to take the needle off the end of the pen, what you do is you just slide it into the big cap, have it click, turn the end, and put the cap back on your pen. Again, this should have returned to 0. If it did not, you did not get all of your dose. This pen can be kept out of the fridge for up to 8 weeks. So if you have a big batch of pens, put them all in the fridge, take them out one at a time, and you don't have to keep putting it back in the fridge as long as you use it within 8 weeks. Try to keep it between 2 degrees Celsius and 30 degrees Celsius. So if you're traveling to a hot country, try to keep it in your air-conditioned room. When you're done with your needles, you take them to a sharps container, either at your pharmacy or our clinic. Do not throw them in the garbage. If you notice a little bit of bleeding or bruising at the site of your injection, don't worry, that's completely normal. You likely just nicked a capillary and there's no need for concern. If you have any questions at all or have any concerns, please just let me know at your next appointment.